Hi, everyone. Thank you so much for joining me. This is Marlene DeRosso, your Women Matter Maven, and welcome back to my channel. If you're new here, please subscribe. I talk about all things women. I try to give a great mix between personal development, life as a mom, an infertility survivor. I'm also a wife and I am a leadership expert. So I kind of talk about a whole bunch of stuff as it relates to supporting women and helping us to achieve our goals, overcome obstacles, become better versions of ourselves, all of the above. And in addition to that, I'm also a doctoral student. So some of my episodes may also be curated around my journey on this doctoral candidacy because, yes, it's not easy, but I'm almost done. So I'm excited about that. This episode I'd like to record today, or I am recording today, is in honor of PCOS Awareness Month. In the month of September, we celebrate PCOS awareness, which PCOS is the acronym for Polycystic Ovarian Syndrome Month. And PCOS is a hormonal condition. I want to preface everything by letting you know that I am not a medical professional. I am speaking on PCOS from my own personal experience. So please don't hold me to anything and make it law, right? Because I only know my experience and I like to share that in case other people are experiencing PCOS, and that you would definitely need to defer to seeking out medical attention or medical advice from your medical practitioner for specifics as it relates to your situation, should that be the case. So, again, I am Marlene. I'm talking to us today about PCOS. So, PCOS is something that there is no cure for. I know that there are many symptoms of PCOS, and the symptoms can be a myriad list of different issues that you may have as it becomes related to PCOS. And it's something that I want to shed some light on because I feel that some young women or young girls, I should say, even in adolescence and pre adolescent, may start exhibiting symptoms of PCOS, but because it's not really talked about much or known much about it, people don't know necessarily what to look for. But PCOS is mainly a hormonal condition, and it in the case of PCOS, at least in my case, and some women, other people too, there is a higher level of male hormone, which is testosterone, and that increased level of male hormone in the female causes one of the indicators of PCOS. Another main condition associated with PCOS is the actual polycysticness of your actual ovaries, right? So it's not just a moniker, that's actually what they look like. A lot of the people with PCOS, one of the things that is used to diagnose them is an ultrasound, and the ultrasound would show their ovaries, and then the ovaries are polycystic. Poly means multi, cystic means fluid filled, and then of course ovaries, right? So in the case when I found out I had PCOS and I started to undergo different ultrasounds so they can take a look at everything, because in my case PCOS affected my fertility. I had those ultrasounds done, and literally on the screen, you have the ovaries, and they look like if you cut a pomegranate, how there's all the little holes when you cut it. That's the best way that I can kind of describe what your ovaries look like on ultrasound when you have PCOS. So all of those are like follicles, and each follicle, for lack of better words, contains an egg. And what will happen is a lot of symptoms that some people in PCOS experience include anovulation, meaning they do not ovulate. So all of those eggs kind of build up because they're supposed to drop one each month, but that doesn't happen. Although I ovulated every month, and ovulation wasn't necessarily one of my situations, I still had all of those follicles in my ovaries, right? Um, and it can be really triggering because all of those follicles, your ovaries help produce progesterone, and which is another hormone, right, that your body normally does. And it's just all out of whack because normally when you ovulate, you have a regular cyst, which is the cyst that releases progesterone. But in the case where I did ovulate, but then I have all these cysts, and then the cysts themselves are like estrogen. So you can see how the levels are just like all over the place, right? So let me back up a little bit more as it relates to the PCOS and the symptoms. I found out I had PCOS when we started on our fertility journey, and we were getting tested to determine or figure out why we had not had any successes in conceiving or starting, for me to get pregnant. And one of the things that came back for sure was that I had high elevated levels of testosterone. And at that point, I'm like, okay, that makes sense. And the reason why I'm smiling is because I remember I was either 17 or 18. And I say that because I was in high school and we were prepping for either homecoming or prom. And back then, many of us drove, but we didn't really drive our cars every day, depending on the scenario. So I remember when we would go shopping, and I think that day I happened to be the driver, and all of my friends were in the car, and we do rounds. We went to like a hotel, we went to a dress shop, we did all this stuff. And I remember sitting in the front seat driving, and one of my other friends was like, "What is that? Is that a hair? Oh my gosh, Marlene has like a beard." I'm like, "Wait, what? Let me see." So then here I am in the car trying to see, with the thing. And yep, I had like 3 or 4 like little hairs there, and I'm like, "Oh my gosh." And of course, 17, 18, you don't really know what that is. And at that point, the only thing I really suffered with was at the onset of my cycle every month, like right before it came, I used to get these big I now know they're called hormonal acne. I used to get those and they were under my skin. So not all of them didn't come to a head to where I could pop them, but they were like, you can see like it's a big bump. So I later came to find out that those were called hormonal acne. They never really came to a head, but they came. And that happens with the shift in the hormones during the menstrual cycle, right? Because your menstrual cycle does this in terms of the different hormones that it produces. So between me having that, right, the cystic acne, and then the cystic hormonal acne, and then the hirsutism, I didn't know the name for it then, but one of the symptoms of PCOS is hirsutism, and which is the excess hair growth. And I was hairy. I had hair, all over my arms, all my legs. Like I was a hairy girl, but I never had, hair here. So, but once I hit 17, 18, I started to have the hair. And the only reason I look like this on camera is because I have my very, 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 okay, loyal, well, I'm loyal to her, esthetician. Her name is Tati, that has been taking care of me since 2007. I was introduced to her via my sister-in-law, and I've been with her ever since. So yeah, Tati keeps me waxed and situated. I looked into laser hair removal, but that's another story for another day. This was back in like 2005, but waxing has worked for me. I have few and far between hairs now. They're not like you guys, I had like, I don't know if you can see, I had like a full, like I have some discoloration and stuff here still. And that's because one time I had so much hair and it started here and sometimes it comes here. You can't see them, but I'm waxed, so you can't really see them or I can't feel them. But they would start here and here and here, like the whole thing was like, and at one point I got so upset because of course I felt shame, I felt embarrassed. Like, who's this girl walking around with all this hair? Like it was horrible. And I tried everything. I did the Nair, and back then they only had Nair for like legs, and I was using it on my face. I had Nair. I did the sensitive, razors with the shaving cream, and just some of everything. And then that's before I found, waxing, and also I would pluck. And one time I was so upset because I'm like, what am I gonna do with this hair? I don't get it. I literally took a razor, like the ones that you shave your legs, and I just shaved, and I felt good. Oh my gosh, it was so smooth. I was like, oh, this is great. No. Okay. Literally, my whole, and I do, this was years ago, guys. I'm like 43 now. Okay. I'm telling you, I did this. I think I was in college, maybe 19, 20, 21. I don't know. No older than that, and I still have the marks from that. When I tell you my skin, like like I don't know if, and again, I use the razor. I don't know if I cleaned the razor. Don't even know where I got the razor from. Full transparency. But I was so frustrated and I just shaved it. And then when it all came back, it was bumps and it was marks. And then I'm trying to pop them and it just made a horrible scar that I still have. Okay, horrible marks there. That's how embarrassed I was with the with this hair. It was horrible. And but the good thing is I always had a whole bunch of hair on my head. So now fast forward to when I started doing fertility treatments. one of the things that they give you to help offset that is metformin. And metformin is also a diabetic drug. So between the metformin, between my hormones, themselves going crazy, I started to have thinning, here in my head. So I had a head full of hair. And then when I started like the infertility treatment aspect of it, and then I guess my PCOS was really getting like out of control, and the testosterone or the inability to balance the estrogen with the progesterone and the testosterone, my hair started to thin, right in here. Eventually it worked itself back, but it was just, that was also bad for me because I've always been known for my hair. And to see that I was just losing it or it wasn't doing what it needed to do as a young 20 something, it's a big deal to you. So that was another symptom. So the actual polycystic ovaries I had the hirsutism, which is the hair. I had the hormonal imbalances. I did not have the no ovulation. I didn't have the no ovulation, and I didn't have the weight gain. The time that I got the weight gain was when I started on metformin. Because that stuff, boy, that thing had me, boy, I don't know. I don't know what was going on, but what helped me get through that phase in my life, it was like 2005, 2004, 2005. And I had gained a lot of weight because I was on that metformin and them trying to regulate my hormones and stuff, is when I did Billy Blank's Taebo. So myself and my mother-in-law, Nella, my husband's dad's wife, we were Taebo fanatics. So we would exercise, and I loved it because it was like a lot of kicking and punching. And I was just like, taking all of my, eagerness and anger and frustrations out on whoever was around or whatever was around, because we really did a number on the Taebo videos with Billy Blank. So weight gain is one of the symptoms of PCOS. And some people with PCOS, they do not ovulate, right? So that's another symptom. And sometimes when you don't ovulate, it causes you to not have a period, and that's called anominorrhea. Anominorrhea, right? Menorrhea. So it's menorrhea and then ano for not having it, right? Absence of the menstrual cycle. Because if you're not ovulating and doing what needs to happen, the body is confused. So one of the ways that you can tell if someone, especially I want to speak to our young adolescents, once they get their cycle and it kind of gets regulated, it should stay regulated, right? It shouldn't be where for 2 years it's regulated and then they go from only having 4 cycles a year or, something like that. That's not normal. Okay. So you want to look at that because that may mean the absence of ovulation, which then can maybe lead to the absence of the menstrual cycle. So it may not be a big deal, right? Because sometimes we don't want that darn menstrual cycle. I never realized how much I love my menstrual cycle until I was going through infertility. How many of you got, okay, anyway, that's another video for another day. But as much as we think that she's annoying, right, Aunt Flo and all this stuff, but you need that cycle and you need her to come correct. You need her to come, with the right flow. You need her to come in the right consistency. You need her to be on point. Should you want to explore starting your family when you get older. So women, don't just let the kids say, oh yeah, I get my period. I'm not pregnant though. No, that's not what it's all about. Okay, you want to make sure that the young people have a more natural cycle so that you can kind of understand what's going on with them and help them as they get older. And just to look out for in case they do have PCOS, because then at that point, the doctors can start working with them to help mitigate some of the symptoms that, that they may encounter. Okay. So another symptom of PCOS involves insulin resistance. And a lot of times with the insulin resistance, it can cause diabetes. That's something that I was very afraid of because, yeah, everyone that knows me knows that I have a horrible sweet tooth. Horrible. I love it too much. It's so bad. And I've always had a horrible sweet tooth. So I was always worried about that, even to the point where when I was able to conceive and have my children and with the pregnancy, I was afraid for that diabetes test, that the glucose resistance test that they do, where they give you that suspension type fluid, and you're there all day drinking this stuff, and then they check your sugar, throughout the time. And as a matter of fact, now that I think of it, part of my infertility screening included that glucose testing, the fasting test with only the glucose. And each time I took it, I passed. So because I know they also said that, I don't know where I read it, but if you are pregnant and you get gestational diabetes, then you are more susceptible to developing diabetes, later. in life as you get older or something. So don't quote me, I'm not medical professional, but that's what they say. So me knowing all of that, and in my head, when every time I did these glucose type tests, I was always worried because I know insulin resistance is one of the symptoms of PCOS. And PCOS itself isn't something that causes infertility. It's all of the symptoms associated with PCOS that may lead to a woman being infertile. Because oftentimes with PCOS, one of the ways that they treat it, and people don't know any better because why would you, right? You go to the doctor because you have a problem and they give you medication, so to speak, and you take it. But one of the things that with PCOS is I hear people say that doctors would prescribe like birth control pills, again, which are also hormonal, to try and regulate their system. So here you are, young adolescent, 20 something, okay, you got a regular cycle because of the help of the birth control. So you're not thinking anything of it. And the minute you're older or just ready to settle down or want to have a baby and you stop the birth control, you start to realize that you have these issues, right? So it's not just, okay, take the medication and then it goes away. It doesn't work like that, unfortunately, right? So you want to make sure that if doctors are putting you on medication to help regulate your hormones, like what's the care plan? What's the plan for fertility preservation? Like how and when do you begin that conversation and talk to them so that you can know what your options are? Because everything in life is just about having options. Things are going to happen to you. It is what it is. But what are my options? And in order to get the best amount of options or the most amount of options is to stay educated, stay informed, ask questions, go to the doctor, get yourself checked out so that if they find something or you hear something, you can ask questions as soon as you find out and go from there. Okay. So as far as PCOS, I just wanted to talk about it a little bit to bring awareness to the syndrome because it is something that affects so many people and so many women don't even know they have it until they're trying to start a family or they just think that they have these symptoms and then, that's it. Something else that happened with me, I also had hyperhidrosis. So coupling my hirsutism, which is the hair, with the hyperhidrosis, which is excess sweating. And a lot of times you get excess sweating, for me, in my case, because of my high male testosterone level. When I tell you guys, I sweat everywhere. Like it was horrible. I had like my feet would be slipping and sliding. My hands, I used to have like a paper under my hand to write. My brother had the same condition, has the same condition. And I say had because mine has significantly got better over time. I have to ask him if he still has the sweaty hands and feet. Some of my nieces and nephews, when they were learning to walk, it was scary because they had hyperhidrosis and their feet were sweaty. So then I'm thinking, okay, was it my PCOS or was it genetic, right? But the good thing is that my nieces and nephews grew out of it. But as they got older, and I'm going to tell you, I have a cousin, okay? He's my second cousin. I'll never forget. My hyperhidrosis was so bad. And then my uncle told me whenever it gets really bad, reset your system by going to wash your hands with soap and water. So that really helped. So at any point I couldn't have access to soap and water, I would be stressed out and that would make me sweat more because I'm anxious trying to figure out where I can find soap and water. He told me that at around like 9. Okay. So I've always remembered that. Then my cousin, which is his nephew, told me, oh yeah, don't worry about it. Cause he's significantly older than me. And he said, oh, yeah. We all have it, that with the sweaty hands and feet, but just, it stops when you're around like 20. Guys, I waited my whole life, every birthday, counting down. 20 came, 21 came, 22 came, 23 came, and all of this to say I want to say I stopped being sweaty maybe after the birth of my last son. I want to say I had him at 37. Okay. So I want to say, what do I want to say? I had him at 37. Yeah, I had him at 2018. Yeah, I had him at 37. So I want to say maybe 40, 41. So I dealt with, debilitating, sweaty hands and feet. And my underarms used to sweat too. And what helped me with that was, I'll never forget, it was one of my coworkers, bless her heart, Marianne, shout out. And she said, yeah, you can't use any of these women deodorant. You have to use Mitchum. Okay, shout out to Mitchum. This isn't endorsed, but that's and mind you, I started working at my job when I was 21. So she put me on Mitchum she put me onto Mitchum, maybe I was 22 or 23. Until now, that's what all the men in my family use, except for the boys. They're still on natural deodorant. And I used Mitchum until I switched to natural deodorant. Nothing else worked for me. Like absolutely nothing. Like nothing. Okay. So and I, of course, unscented, because you can't have body odor and you have odor in the deodorant. No, unscented. It helped keep me dry. And if I needed to, I would just wipe down. Like my uncle said, always reset with soap and water. So anybody out there with sweaty hands and feet, reset with soap and water. Rest in peace, Uncle Gilbert. He gave me that piece of advice and it was just amazing. Okay. But now I don't have that issue, thank goodness. But I think that was because of shift in hormones, because of course, me and my PCOS, I'm on the other side of infertility now. And I think this is me, doing a little bit of reflection. I'm having a really hard time with perimenopause. And when I tell you my hormones are taking me for the spin of my life, it has been very, very tricky. And I'll do another video on my perimenopause symptoms. And perimenopause affects everybody, but not everyone. Just like we anticipate the onset of our cycles when we're little girls, and everybody makes a big deal of it, people need to talk more about perimenopause and menopause. And it was very debilitating. My hormones are literally all over the place, you guys. It's so bad. I've been hospitalized, to tell you the severity. I've been hospitalized twice, okay, in the emergency room for a few days. I couldn't drive last summer. It was my staff and my coworkers that were taking me to pick up my kids from summer camp. Like the anxiety and the panic, and you literally feel like you're dying. And my sister got to see it one time. We were in the car driving. I was totally fine. And literally out of nowhere, I got dizzy. I was drenched in sweat. They didn't know what to do. Like, did we pull over the car? What's wrong with this girl? Like, literally, I turned white, drenched in sweat, and I literally thought I was gonna pass out. I had to take a pill. Like, it's horrible. It's horrible. So I'm managing. I've been doing my acupuncture. I have to say I've been extremely busy, so I haven't been able to keep up with my acupuncture appointments, but that has helped a lot. And I'm trying to incorporate more natural teas and herbs and stuff into my diet to try to help, because it's been a whirlwind. So, and I think my PCOS has to do with it because I had such messed up hormones, all throughout my, premenopausal life, right? My menstruating life, and now they're like, okay, well, what do I do? What are we doing with this? So I have to look into that a little more. So I just wanted to come to everybody to talk to you about PCOS. It is something that a lot of people suffer from, and everybody's symptoms are different. And everybody is affected differently. You might have some people with PCOS and has no issues, getting pregnant. You might have people with PCOS and they do have issues getting pregnant. So, you might have people who have all like the indicators, but they have no outward symptoms. So it just depends. So it's really important to, talk to each other about it, look out for the youth, try to help them, listen to them if they're telling you that they have pain or they didn't see their cycle or the consistency is different, or, they have acne that hurts or they're growing hair. And I wanted to say about the hair too. Now, because my hairs are really scattered, I just go to get them waxed. They're not as bad in terms of like how full they are. Much thinning has happened down there. But you guys, guess what? Why are all the beard hairs gray? So now I have no choice. Even if I used to get away with like not having to go consistently, because you couldn't see it, you just put on some makeup and call it a day. Oh no, not now. They're gray and they're peeking through, right? So yeah. So listen to the women and the girls when they tell you what they're feeling and what they're going through. Spread the awareness of PCOS. Talk to your doctor. Get your test ran. Do what you need to do to find out if you have it, so you can start knowing what your care plan is for fertility preservation, especially, and for when you get older with your hormones, and trying to, treat the symptoms so that you can live a very healthy, symptomatic life. So, okay, that's it for today. Thank you so much for joining me, and stay tuned. Like the video. If you have comments, comment in the video. If you've had PCOS symptoms, maybe I missed something. I'm just speaking from my experience. And subscribe. Don't forget to subscribe, share the video with someone else if that's the case. And I look forward to interacting with you down below. Have a great day. Thank you so much for watching my channel.